Hello, everyone, and thank you for joining us for the next part of our Pathways to Prosperity webinar series hosted by Vanguard Communications. Our webinar today, titled 5 Ways to Make Your Practice Less Hackable, will be presented by one of the most important people here at Vanguard, our technical director, Jonathan Stanley. If you have any questions during the presentation, please feel free to chat them in the sidebar to the left of your screen, and we will try to address them during the Q&A part of our webinar. We will also have an ongoing Twitter feed with the hashtag #PathwaysByVanguard if you would like to join the conversation. So I would like to introduce Jonathan Stanley, who is a graduate of the University of Texas in Austin and a self-proclaimed tech geek. He has a wide array of experience in web development and has won several awards for his work online, including the Golden Web Award. Jonathan has been the leader of our online security efforts here at Vanguard and has helped keep us at the forefront of internet technology. He has invaluable knowledge when it comes to keeping medical practices safe online and offline, so we are very excited to have him speak today. So without further ado, the stage is all yours, Jonathan.
Thank you, Kayla. So security, information security comes up all the time with medical practices. It's one of the things I hear doctors have the biggest concerns about. And as I see everyone sort of deal with the challenges of security, I get a little bit of some interesting results. And I was able to scour the internet to find an image of something that pretty much approximates what I see when I see a lot of different practices with their security. And it looks something like that. Complete absence of security in almost every place except for one place that just has an absurd amount of security. So what I like to do is actually focus on the fundamentals, and that might sound basic for some, but you actually should get a lot out of it, whether you're new to security or whether you have a long history of security. The fundamentals are good for everyone. So let's get started. The first thing that everyone needs to know in healthcare is what PHI is. Protected health information is any information that associates an individual with his or her health. So as soon as you connect a health record or anything related to health to an individual, you have created PHI. And this can be some unusual things. So for example, Jane Doe as a patient of Dr. Smith, that's PHI. Our cancer clinic received a phone call from some phone number. So simply having a phone log of phone calls from different phone numbers is enough to identify someone. That's PHI. You're associating that phone number with a cancer clinic, that is PHI. A patient sends you a wonderful thank you note and you post it on your Facebook page without getting their permission. You have just violated PHI requirements because you are identifying a patient with a particular medical practice. So a lot of things that you might not expect could be PHI, a lot of them are. So again, in its simplest form, PHI is anything that happens as soon as you connect a health record with an individual. So PHI is actually a little bit like work for hire in the sense that a lot of doctors are the ones that may be creating it, but they're not the ones that own it. The patient is ultimately the one that, quote unquote, owns the PHI. So without a written waiver from the patient, the practice must protect the PHI. And there's a lot of reason for that, and probably the most important that doctors and practices will care about is that failure to protect PHI results in huge negative publicity, lots of legal and other costs, and some massive fines. So a 2015 study showed that the median cost of healthcare breaches was about $75,000, and the average cost shoots up to $675,000. It's a tremendous cost, and that doesn't even count some of the other costs that are incurred in relation to that. But that's a pretty big cost to risk. So that's why it's one of the strongest topics that we see in regards to healthcare. So again, make sure that it's not just the administration that needs to know what PHI is. Every single team member in a practice and that's working with a practice needs to know what PHI is. And this is a good way to start, is the basics with that. So now that you know what PHI is, your next step is to get everyone using strong passwords. So the majority, and by majority I don't mean just 50 or 51%, the vast majority of passwords can be cracked in a matter of seconds or days by a common computer. They're very, very weak. Many password crackers can do thousands or hundreds of thousands, sometimes millions of guesses per second. So it's very quick to break a weak password. So there's some do's and don'ts with passwords. The don'ts: don't use short passwords. Don't use words like things that be found in a dictionary, or common names, or birthdays, or any sort of sequences. For example, if you mash your hands on the keyboard and hit the letters side by side, they might come out in a certain sequence, like QWERTY. Obviously, you don't want to write down your passwords anyway. You have to be able to remember your password without writing it down or storing it anywhere. So what you do want to do is you do want to have long passwords. And by long passwords, a minimum of 12 characters, but you should always strive to do as many characters as you can reasonably remember. So some websites will limit you to a certain number of characters, but try to get as many characters as you can. Some of my passwords are 30 plus characters, so try to get them as long as you can. Try to use as many numbers, special characters, and varying case with your letters, so capitals and lowercase. And this really makes your password a lot more complex for the same number of characters. So you get a lot stronger password even though it's only 12 characters. And one that is often not done, this is probably the biggest struggle, is to use a unique password for every single website and service. So especially when you see people using their email password as their computer password, is their health password, you don't want to share the password with all the different systems. They need to be unique. Ultimately, what you want your password to look like is something like this password here at the end. Capital H, exclamation mark, capital D, comma, lowercase a, capital I. It is a complete hodgepodge of letters, numbers, and different characters. So you're probably thinking to yourself at a certain point, there's no way I'm going to be able to remember a password like that. That is way too complex. Well, actually, you might surprise yourself. That password is actually just a sentence. The sentence is, "Hi, I'm Doug, and I'm a 35-year-old. Do you want to dance?" Take the first letter of each of those words, smush them together, and you get that password. You keep the punctuation in place, keep the numbers in place, and you get all these different letters, numbers, characters into a single concise password, and you can easily remember that phrase, "Hi, I'm Doug, I'm a 35-year-old. Very easy to remember, very complex. It gives you a pretty good way to remember passwords. So just try to think of some phrase that you might remember and use that to create a password. Obviously not like the Star Spangled Banner or something common, but try to do something a little bit special for you. But even if you have that really nice password like that, now you're thinking, okay, well, I got that nice password, but now how am I going to possibly remember my password with all these different websites and services that I log into? Well, there's actually a really great solution, and that is using a password manager. Once you start using a passwords manager, you only have to remember a couple passwords. Every other password with every other website and every other service can be completely random. So now that I personally use a password manager, I never type my passwords. I have no idea what my Google password is. I have no idea what my Facebook password is. I have no idea what almost all of my passwords are. They are all completely random gibberish. So the way that works is there's actually two major companies doing this, but there's probably a few dozen pretty popular services that have some really nice password managers. But LastPass and 1Password are two very popular ones. They're both excellent tools. I'm not as familiar with 1Password, but I've definitely had a lot of experience with LastPass, and I've reviewed them to make sure that they're as secure as you reasonably can get. So modern password managers, they utilize what's known as client-side encryption. And what that does is it creates what's called a zero knowledge cloud. So that's a lot of dense language, but what it means is it's giving business users the highest possible level of security for sensitive data and files. So if you use something like LastPass or 1Password, you're getting the highest possible level of security for sensitive data and files, and that's what you want. Now, this can change as things move forward, but as it stands now, this is a really great tool. It'll save you time, it'll save you effort, it'll make your overall security picture look much, much stronger than they do today, because every single website can be unique and they can all have really, really strong passwords. That's going to be a huge bump up. Now, if one of your websites that you log into is ever hacked, you have no risk. You just change that password and none of your other websites or services are possibly compromised. You have your team knowing what PHI is. You are using strong passwords. Your next step is to start trying to limit your exposure to the risk of PHI data breaches. One thing you might not know is that in the past decade of data breaches, the most affected industry was the healthcare sector. It is over a quarter of all breaches is just in healthcare. I can't overstate this enough. The hackers and data loss and lost laptops and all these different things, healthcare is by far the biggest risk. So health providers need to be really paying attention to where PHI can leak or be breached. Now, a certain amount of PHI in a health practice is obviously inevitable. You're going to have some. But that doesn't mean you don't need to take a look to try to see if there's any ways you can limit your risk of breach. And the way you can do that is limiting the amount of PHI that's created. So one example of that is email. Every time you email and every time a patient emails, PHI springs into existence because you're associating an email address with a particular medical practice, even if it contains no medical information, just the fact that you're emailing together, that you're already starting to associate the name with the practice, and that can be considered PHI. So this isn't to say like, vendors and things like that, but the idea is as soon as you have identified someone as a patient of a practice, you are creating PHI. And so a great way to not have the risk is to not have email as your system. You need to find a secure messaging system as a replacement for that. So you do want to keep in touch with your patients, but you need to find alternatives to email. Also, when you contact a patient, are you leaving PHI in a voicemail? So you could compare two potential voicemails that you might leave. One might say, "Hi, this is Dr. Stanley, and I'm leaving a message for Mr. Smith regarding his test results at our practice." Now, I've just said to this person, I've identified them as a patient, I've created PHI when I said that. What I could instead say is, "This is Dr. Stanley, and I have a message for so-and-so, please give us a call back." I have not identified the person as a patient. I've merely said that there is a message. So therefore, no health information is conveyed. There is no PHI. You've reduced your risk. Onto your websites. So every medical website today, every healthcare website, every practice website needs to be HTTPS enabled. Now, what this means is that the information as it's transmitted between the visitor of the website is encrypted. This is a good idea for your risk. It's a good idea for the patient's risk. It's a good idea for HIPAA, but it's also just a good practice in general. It helps let the patients and visitors to your website know that you care about their privacy and about their security. So it's a good indicator. One of the big problems, though, is it's very rare actually in the industry to have HTTPS websites. So if you spend a little bit of time, you'll find a lot of companies like ours that do encrypt websites this way, and it's pretty readily available for anyone that wants it, but a lot of vendors aren't doing it, so try to find someone that will allow you to encrypt your website with HTTPS. So again, remember that you can limit your exposure in lots of different ways, and try to find those ways and try to limit your exposure. And the way you identify that is just think that every time you have associated a person's name or other identification with the health record, if you can keep those things separate, you're keeping the risk away from your practice. All right, so you know what PHI is, you're using stronger passwords, you're limiting your exposure. What's next? That is encrypt everything. So lost and stolen devices account for 41% of security breaches. Everyone always thinks that it's hackers and there's really malicious people in China or someplace across the globe that are tapping in secretly to your computer systems, when actually 41% of the cases are people forgot their laptop in their car and someone stole it. So instead of trying to focus on the really technical things, what you'd probably be a lot better off doing is focusing on what the Health and Human Services says. And what they say is that stolen laptops lead to important HIPAA settlements. But they also say that practices that secure health information through encryption or destruction are relieved from having to notify. And so what Health and Human Services is saying is that if you encrypt your devices, you no longer have to worry about those devices being stolen or lost or anything like that. If one of those devices is stolen, it is as if no security breach has occurred. So just let that sink in, that you can have a device stolen and you no longer have to be worried about it. That's going to take care of 41% of your possible risk right off the top, is encrypting all of your devices. So how do we encrypt? So the first thing you have to recognize is that encryption is not just a password. You need to actually make sure that your IT team or most people can do it themselves, but you need to ensure that your devices are actually encrypted, not just password protected. And the best way to do that is with a risk analysis and a device audit. And what you would want to do is get a spreadsheet of some sort or a list, an audit that says each of your devices and identify each of your devices, if they're encrypted, when they're encrypted, and their current encryption status. Once you'll do that, it'll help you find a lot of devices that you might not have thought about. So when we did it with our business, we found a lot of devices that we thought were encrypted. Maybe we thought staff had a better understanding of encryption than they actually did. Or maybe we thought certain devices didn't have to meet the encryption requirement. And through the audit process, through getting a list of all our devices, we realized so many places that we had that were weak that we were able to strengthen through that device audit. So that's a really good tool for you to do, which is getting that device audit going and making sure that all of your devices are encrypted. Some of the devices you want to look out for: laptops, thumb drives, hard drives, business and personal smartphones. So that was a big one for a lot of different practices that I've spoken with. The personal cell phones, if they're accessing work information, if they're accessing PHI, they are just as subject to encryption requirements as any other phone. So personal and business smartphones all need to be encrypted. Backup disks, fax machines, home office computers, anything that might be used for the practice that might access PHI needs to be encrypted. Now, once you've identified all these devices, you need to ensure that they're encrypted, and if they can't be encrypted, you've got to eliminate it from your system. You can replace the device with a similar device that can be encrypted, or find some alternative, but the best solution is going to be to simply eliminate those devices that are not encrypted, because that's going to be a huge, huge risk for you. Like I said, 41% of all cases are lost and stolen, and that's a huge risk to incur for not a lot of gain in most cases. All right, so the last tip that I would recommend for everyone is to have ongoing education for staff. Now, a big misconception is that security can be solved by a computer program. Security is not a computer program. Security is a team effort. Every single person on your team has to be trained to recognize and manage PHI and handle it properly. Health and Human Services is actually not going to excuse your business because your employees weren't trained well, or they misunderstood, or your employees made an error, or if it was inconvenient, or if it was just ignorance. In other words, the HHS won't accept Hillary Clinton type excuses. You've got to go with ongoing education, just like you do with ongoing medical education. You have to do it with security as well. And this is also true because the environment for security changes rapidly. So what might work today can become inadequate tomorrow. As soon as a security vulnerability is discovered, things will change. So you've got to keep up with it, and that is a huge part of your overall picture, is just making sure that from time to time you have a group meeting where you sit down and very deliberately discuss security and how it applies to your practice. So as part of that too, you want to have a conversation with everyone that participates on your team to get feedback, because security isn't just something that you dictate and everyone follows. People have their own ways of doing it, and if you create a system that's really complex, it's not going to be effective, and people are going to forget, or they're going to neglect, or things like this. So you want to take people's feedback to try to create the easiest solution. This doesn't mean that you're going to compromise with the security that you need to put in place, but you often can find ways to accommodate people's requests. And sometimes you might find things that you might not have thought about. For example, security doesn't just exist on digital devices, it also exists on paper. It also exists on written notes and printed papers, and even verbal communications can convey PHI in the certain context. So try to get your team feedback and get everyone participating and making security a group effort. One way you can also look at that is just to think about how cars first started. When they first started, there were absolutely no locks. That's sort of where the state of the internet is, has been up until the last couple of years, is no locks. So once people realized that we needed to have some security, we just did simple keys. And now we've gotten even better solutions, and those solutions are remotes. You don't even have to touch your car, you just push a button. Try to find security methods that will be just as simple as that. You simply push the button when you leave, and the thing is secured. So if you can find something like that, you're going to be much better off. Try to avoid the really complex systems that give everyone a headache, and that will be the best strategy for you. So those are the 5 tips, and from there, if anyone has any questions, I'd be happy to answer those.
Fantastic. Thanks, Jonathan. The first question that I've come across here is actually about talking to your staff about these security measures. What's the best way to relay this information to your practice staff? Are there any good resources on information security? Should we call a staff retreat? What's the best way to get them on board?
I think a luncheon of some sort, or some physical meeting is by far the best way to go. If this is something that's sent in a memo or an email, it just does not sink in. You have to get someone that understands this pretty well to sort of present to the group and make sure that the entire group understands and answers questions, because everyone has a different piece of the puzzle, and everyone's going to have a different understanding of how security will apply to their particular working environment. So you've got to be able to answer those questions for everyone individually, so we can have a team effort towards security. It needs to be in person like that.
Okay. On the topic of the staff, the password managers that you mentioned, are they just for private use, or can they be used by multiple people in our practices?
So that's actually one of the greatest features of password managers. Once you set up a password manager for your practice, your team can coordinate passwords together. So if there's a login for a particular website that several people need to have access to, you can delegate access to those several people through the password manager and revoke access immediately whenever you decide. So it actually creates a much more collaborative environment for getting passwords between your teammates, and it saves a lot of time. You're not emailing passwords or going to look at some spreadsheet or whatever system you might be using now. Once you go to a password manager, you're going to save time like you wouldn't believe.
So how do we know that these password managers won't be hacked?
I sort of addressed that in the slide. What the password managers are doing is they are encrypting on the client side. And what that means is when you type in a password on your machine, it is encrypted immediately. And before it is ever synced to any cloud service or anything like that, is encrypted before it's ever sent. So even if the password manager was ever to be hacked, it doesn't matter, because the information that they store is all already encrypted. There is nothing for hackers to take because it's already encrypted. Now, there's other services. I'm trying to think of an example here. Let's not give any examples. There's some services that will store your files and emails and things like this, where they have access to. Actually, we do have some examples. Let's say like Apple and Google. Apple and Google have access to your emails. If the FBI or someone requests access to those emails, Google will say, okay, we'll get those emails from your system, we'll give them to the FBI. With a client-side encryption system, there's no way for the vendor to ever have access to that data. It's encrypted before it even touches the cloud. And so from that standpoint, no one has access to the passwords other than you. It's as secure as any other system. In fact, is the most secure. I forgot the exact wording of it, but it's basically the most secure method of storage that is available today.
Great. Okay. I had quite a few questions here about communication with patients. So I'm going to jump into a couple of those. The first one is, what should I do if a patient contacts me via email? Should I just ignore it? Should I ask the patient to send the question via our EHR? Should I call the patient? What should I do in that situation?
Well, I think it sort of depends on each particular practice scenario. What may work for some may not work for others. I mean, obviously, if I'm a patient, I would love a phone call. Everyone would love that, but that's not going to work for every scenario. First of all, there's no reason the patient should ever have your email in the first place. If they don't have your email, there's no way for them to email you. So you shouldn't be giving out your email in the first place. You should be giving out your EHR information or whatever secure messaging system that you might be using, but you should not be advertising your personal email to patients. If somehow you do get something sneaking through, I think your best bet would be to simply not respond to that email and to respond to them some other way, for example, through a phone call, through a secure message, or whatever system that works for your practice. Follow up that way and simply make sure that the patient does know that you have responded, but not directly through the email.
So if the patient is in the office and you're asking them for like their social security number, for example, while they're actually physically in the office, is that a security issue?
My understanding is that, well, as far as a security issue, no. There's no disclosure there unless you have some recording device in the air or something like that that's picking up the sounds. Then no, that's not going to be a security risk. Obviously, if you have a video camera that takes audio, then that would be. But in the vast majority of cases, I can't imagine that would be any sort of security risk. Now, just to be clear on that, though, again, you're going to have to collect the information that you require. But if there is a way to keep the personal information separate from the health information, you can avoid a lot of the creation of PHI, and you can avoid a lot of the risk that comes with that PHI. So that's not saying that because they're in person, there's any sort of different risk there. It's just saying that the more you can keep that information separate, the safer you'll be in general. Okay,
thank you. So do you have a few security recommendations for laptop computers owned by the practice? What are some good safeguards for those laptops?
I suppose my biggest recommendation would be keep your device encrypted. It can't just be password protected. It needs to be encrypted, and it needs to be up to date. If you have a laptop that is old to the point that it doesn't have encryption, you need to find something newer. If you have one that has some sort of legacy software on there that you can't update to the latest version of Internet Explorer or something like that, you've got to find a way to keep it updated with the latest security, because it's not uncommon for me to see practices having to use older software and then they don't update their system because they're trying to keep using this old software. So keep your devices encrypted and keep them up to date.
This is an interesting question, since we've been hearing quite a bit about the battle between the FBI and Apple. What are the implications for health records if the FBI gets access to smartphones? Wouldn't that make it easier for hackers to get access to other people's health records? Do you have any thoughts on that one?
Yes, that's actually one. I think a lot of Apple's argument in that case is that if Apple defeats their own security measures to accommodate the FBI's work to try to find terrorists or whatever they might be doing, that's great for solving that particular case. But in the end, hackers and people that have other motives are going to find those same security issues. And once those are found out by those with different motives, then that's going to make it much, much easier for them to exploit those to get everyone's medical records. And by the way, medical records are already the biggest target for identity thieves, but not only are they the biggest target, they are by far the most valuable. I think a stolen credit card today, it sells on the black market for like a couple dollars, and a health record and health records will sell for 50 or hundreds of dollars each record. So they're much more targeted and they're much more valuable. So once security is weakened, the whole thing is going to have to change again. So yes, the FBI can, if it does force Apple to break down security, can cause additional HIPAA risks through that in a roundabout way.
Great. Well, if we don't have any more questions today, we will just close it there. If anyone listening does have any more questions, feel free to contact us at Vanguard Communications. Many thanks to you, Jonathan, for your wonderful presentation. Everyone who registered for this webinar will receive an email with access to the recording of Jonathan's talk, as well as past webinars. If you've attended a Vanguard Communications webinar before, your password will still work for those recordings. So before we close, I wanted to remind everyone to take the survey following this presentation and sign up for Vanguard's newsletter. Also be sure to watch your emails for more information on our next webinar. So thank you again for joining us, and have a wonderful evening.